Hello, everyone, and welcome to Heads Up, the weekly podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, chronic daily migraine survivor, and founder of the Facebook group Migraine Nation. I am lucky enough to be here this week with Dr. Betsy Seng. Hi, Betsy. How are you?
Hi, I'm good. Thank you for having me.
Dr. Seng is a health psychologist. She is also an associate professor at Yeshiva University and Albert Einstein School of Medicine. She is here to talk to us today in our series on behavioral medicine related to migraine. And today we're going to talk about cognitive behavioral therapy. Last time we talked about biofeedback. And we like to point out that our view on these things is, I think, an important part of what we're doing. We often, as people with migraine, I think are made to think that we got this way, we got this disease, we got this pain, because maybe we lacked at these sorts of behavioral therapies, when in fact this isn't the case. We just need to be superheroes at these sorts of things. We need to be super great at them in order to overcome our disease. So I want to move now that I've said that, I want to move on to Dr. Seng, who's really good at explaining this and who knows a lot about cognitive behavioral therapy and its relationship to migraine. So Dr. Seng, I think there's a lot of confusion about what cognitive behavioral therapy is, which I think we can just call CBT to make it easy. Can you define it for us and its relationship to migraine?
Yeah. So CBT describes a huge number of strategies that are used by people like psychologists and counselors and social workers to help people, a variety of types of patients, manage lifestyle and thinking issues related to a variety of diseases.
Right.
So just knowing what CBT might look like for one thing, like depression and anxiety, doesn't necessarily help you understand what CBT might look like for migraine or diabetes or any number of medical conditions.
Right.
CBT really depends on what cognitions, which is the fancy word that we use for thoughts, what thoughts, and then what behaviors we're trying to target. So for people with migraine, we try to target a lot of behaviors first. So there are certain stress management behaviors that are really useful, like relaxation or sometimes biofeedback. There are behaviors that we know are associated with migraine attack onset, like poor sleep or inconsistent eating and hydration. So we may work on keeping a really consistent daily life or helping people manage their sleep better in the course of a CBT for migraine. There are also certain thought patterns that are really, really common in people with migraine that can especially interfere with acute management of an attack. So we might try to help people understand what happens in the hours leading up to an attack and how can we help better prepare you so that if it comes, you're ready.
Okay. So I do notice when I hear people talk about whether they want to start CBT or not, that they wonder if it's tailored to an individual's thought patterns or if it's just sort of the same old thing that they read about online that people have already told them to do 100 times. So is it tailored to the individual, or is the theory that most people with migraine sort of have similar thought patterns?
There are a handful of thought patterns that come up a lot in people who have a chronic pain broadly and migraine specifically. That said, any individual person with migraine may have one thought pattern but not another. And no matter what, every person's thought pattern is going to manifest in a different way. A really good example is called pain catastrophizing. So this is the idea that when you start to experience the symptoms that happen before a migraine attack, the warning signs, there are some people whose thought pattern, their rut in the road just rolls down the hill like, this is the worst thing that's happened to me. It's never going to get better. This is, it's just a catastrophe. And that's called catastrophizing. Not everybody thinks that way. There are some people for whom when they get those warning signs, they say, all right, this is going to be a challenge, but I can deal with it, and here's my plan. So our goal is to help people who typically are in this rut in a road and roll down the pain catastrophizing hill.
Great.
Help give them strategies to help get them on another path.
Okay. Are most of the responses to stress that are addressed during CBT, are they subconscious or are they conscious to us before we would go through this type of program?
So a lot of these thought patterns, and it can be responses to stress, it can be responses to, family members or job. It can also be responses to the migraine attack itself,
Yes.
or to worry about having an attack on a particularly important day.
Right.
All of these thoughts, some of them are, what happens is that they're most conscious to us near the end of the road. We notice them once they're translating into actions and feelings.
Mm-hmm.
The goal of CBT is to help people get insight to the actual thoughts that are preceding those feelings of panic or stress or anxiety or, being overwhelmed by the thought of another migraine attack or worry about the possibility of a migraine attack.
Right.
We want to help you back up and say, okay, where is that coming from?
Mm-hmm.
Because if you're already all the way at the end of the hill, you're
Right.
already there. you're in the, your cart has already left.
Yeah.
But if we can try to divert the cart at the top of the hill,
Yeah.
and then that will give us a way to help you respond better in the moment.
Okay, I love the cart on the hill analogy. It's a very good one. So part of CBT is often keeping a diary. Can you tell us the purpose of keeping the diary and how long people usually keep it?
Yeah. So you don't want to keep a headache diary forever. That can, not only is it overwhelming,
Yeah.
but you spend, the goal of CBT is that you don't have to focus on your symptoms so much anymore.
Right.
You can focus on living your life, right?
Mm-hmm.
So you don't want to keep a headache diary forever. And for some people, keeping a headache diary at all may actually be counterproductive.
Right.
So for people with a certain disorder called generalized anxiety disorder, we may actually not keep a headache diary at all, because focusing on symptoms might just be too overwhelming, and that's okay.
Yeah.
But we do like to keep a headache diary. The biggest reason you keep a headache diary is to understand how your symptoms have changed over the course of treatment. The hope is that you see at least a decrease in disability, and then hopefully a decrease in actual headache days as well by the end of the course of treatment. It's difficult to remember exactly how many days you had and how disabled you were each day.
Mm-hmm.
It's a lot easier when you just write it down. It doesn't have to be like really complicated.
Yeah.
The other thing that a headache diary can help with are teaching you about how individual behaviors are related to your headache, and to help you learn certain skills that you might learn along the way in CBT. So for example, sleep training is a really important part of CBT for people who have certain sleep patterns. But for everybody else, it's a sidebar. So the therapist needs to see what you're really doing when it comes to when did you go to bed, how long does it take you to get to sleep, how many times did you wake up, what time did you wake up in the morning. All of these things may seem like really annoying nitty gritty to the patient, but to the person who's working with them, that is critical. Even if you only do that really intensive sleep tracking for a week or two, that tells me, is this something that we need to focus on, or can I work on other stuff? Right. The same thing with like skipping meals. Typically in CBT, you might track your meals for a couple of weeks, sometime in the middle, to see if that's something that's important for you to work on. Right. We don't know what is going to be the most important skill to work on with patients until we see their diaries and we see which skills they seem to have trouble with and which they've already mastered.
Okay. So my next question is, do you think it's possible for a person with migraine to use apps on their phone or books related to CBT to complete a course sort of CBT that would help them with their migraine, or should they always seek the help of a psychologist?
There are certain apps that are evidence-based treatments for the diseases that they treat. The best example of this is CBT for sleep. So if you have been working with your neurologist and they see that your sleep is really out of whack, and that is a very, very common precipitating factor for migraine attacks.
Mm-hmm.
You might want to do a course of CBT for insomnia to try to help get your sleep more on track and more regulated. There are two wonderful evidence-based applications for that. One is called Shut Eye, and the other is called Sleepio. Both were made by psychologists who developed the training. They're lovely. They're great.
Mm-hmm.
So when resources like that are available, definitely, it's a good place to start.
Mm-hmm.
There are no currently publicly available applications or books that lead people specifically through CBT for migraine. So I think that if you have already started to just like look at stress management stuff online, you're looking at stuff online, and you haven't found the first line of defense skills to be useful, it's a good idea to seek out a clinician. The best clinicians for CBT for migraine are going to be people who are psychologists trained in health psychology, because they're used to treating medical diseases, not only psychiatric conditions.
Right.
So they'll be able to help you target the CBT skills specifically to treating migraine attacks and trying to reduce how many attacks you have.
Okay. Are biofeedback and CBT often carried out together?
Biofeedback can be an important part of CBT when people have a hard time understanding or really capitalizing on relaxation skills.
Mm-hmm.
So relaxation skills are kind of a foundation of CBT for a lot of medical conditions, but migraine especially. They're the first thing that we treat. We typically spend a whole month treating relaxation and trying to help people really learn how to use it in their daily lives, because both increases and decreases in stress can precipitate migraine attacks. So we want people to have a low, constant, pretty steady level of stress.
Okay.
So for some people, just learning deep breathing, just learning the relaxation techniques that we would typically treat like progressive muscle relaxation, body scanning, imagery, that works. They feel much better. They start to see a reduction in their headache frequency, and we can move on.
Mm-hmm.
But for some people, it doesn't quite stick. They're not sure they're actually getting it.
Mm-hmm.
And they have, especially for people who have a hard time, we call it interoceptive awareness. They have a hard time feeling their body.
Right.
They don't feel their heart rate. They don't notice their breathing patterns.
Right.
Biofeedback can really, really help pull the veil back and show people their body patterns on the screen, rather than hoping that they can just learn how to be aware.
Okay. On average, how much improvement do you believe people see by undergoing CBT? How much improvement do they see in their migraine and in their pain?
Yeah, so there is a really, really great study that was published by a mentor of mine, Ken Holroyd, in 2010, that looked at the kind of most commonly used preventive medication at the time, which was a beta blocker for pranolol,
mm-hmm.
and the CBT protocol for migraine, where we met with patients 4 times over the course of 3 months, and there was a manual. The patients learned how to do the skills on their own at home.
Right.
And beta blockers and CBT worked about the same. And when you put them together, that's really where the big difference happened. So we saw a much larger proportion of people experience a 50% reduction in headache attack frequency when you were both using a preventive medication and doing CBT for migraine. So I think that's another important point, is that one of the things that we do in CBT for migraine is that we help you make sure you're taking your medications, make sure you're getting to your doctor's appointments. We help you deal with, how do I know if an attack is bad enough to take a particular type of medication or another? What's my plan? And CBT helps you use your medications better. They're supposed to be used in combination to really affect the biggest change.
It goes back to something we talk about on Heads Up a lot, is that all these things that we bring on the podcast are sort of pieces of the pie to use to attack your migraine disease or your headache disorder or bricks in the wall. And that I think a lot of times people think they're going to find the one thing that's going to fix them, when in fact it's often more of building a wall against the migraine using separate bricks. So I love that you brought that up. And can you just really quick tell us, I think that people get a little bit confused or they're curious about when you do look up CBT, if you want to learn about it, it's often, excuse me, mindfulness-based cognitive therapy also comes up. So can you tell us what the difference is between CBT and mindfulness-based CBT?
Yeah. So mindfulness-based cognitive therapy is an extension of mindfulness-based stress reduction.
Okay.
And it was originally meant to help people who were who had been depressed, but who had been successfully treated, to help them stay better. Okay. So the goal of MBCT really does seem to be to help people stay better and for their disease to impact their lives less. Okay. I recently conducted the largest trial of MBCT for migraine in people with migraine to date. Okay. 60 people, still not humongous, but we're working on it. And we found that same thing to be kind of true. So for MBCT, we did not really see any reduction in headache frequency and migraine attack frequency and headache day frequency at all. Okay. But what we saw were very, very large reductions in headache-related disability. Okay. So right now, my recommendation is that for people for whom they still experience a lot of headache days, their attack frequency is really high. Right. CBT is meant to change behaviors that are associated with attack onset. So it's a behavior change intervention, and it has been associated with a reduction in attack frequency. Okay. But for people who have had some success, either with CBT or medications or, whatever other interventions or a combination, but migraine is still interfering with your life. You still think about it every single day. Yeah. It's still, it's just still this cloud in the room. That's when MBCT might be useful. The goal is disability reduction rather than necessarily headache day reduction.
Okay, that's a very interesting way to put it, and probably something that most people did not know. Is there anything else you think people with migraine and chronic headache should know about CBT before we close out today?
No, I think that the biggest thing to think about CBT is that it's CBT and. It's CBT and your acute medications. It's CBT and maybe some preventive medication or some other strategy to help reduce migraine frequency. These things really work best when you put them together.
Okay, thank you so much. And I hope everyone enjoyed today's episode of Heads Up and learned something really important. Please join us again next week. Bye-bye.